So in answering this question, I'm trying to look at what the anatomical basis, why the metaphysis is the common site for osteomyelitis in children. There are some things you are supposed to look at. All right, there are some things that you're supposed to know before you even attempt this question. Now, one of the things you should know is what is anatomical basis? Anatomical basis is you actually trying to what? Give reasons. You are trying to convince your examiner to why this thing is happening. Okay? You are supposed to know what a metaphysis is. If you don't know what a metaphysis is, you have problem answering this question. You are supposed to know what osteomyelitis is. Okay? So let's just go over again. So osteomyelitis simply means what? Infection of the bone. Okay? Metaphysis is basically what? This part of the bone that is joining the diaphysis and the epiphysis. So they're trying to ask you, why is it that what? If there's an infection of bones in children, it always happens at the metaphysis. Let's give the reasons. We said that the metaphysis is the most common site for osteomyelitis in children due to its unique anatomy and physiology. You must start your heading like this. The examiner will now prepare himself that he's dealing with an intelligent candidate. All right. Now, because of the blood supply, the metaphysis has a rich blood supply with numerous small vessels that branch off from the nutrient artery. Okay. So now this increases blood flow and makes it what? More susceptible. What's another word for susceptible? It makes it more easier for bacterial infection to actually what? Bacterial infections that have gotten into blood. Okay, that's bacteremia. Okay, so if there's bacterial infection that has gotten into blood, it will go to where there's rich blood supply, right? And that's the metaphysis. Okay, so one of the bases is what? The blood supply. Then a slow blood flow. The blood flow in the metaphyseal vessel is what? Slower than that in other areas, and this will allow for bacteria to settle, have time, grow, and colonize more. Okay, then another reason is what? The absence of basement membrane. The metaphyseal vessels lack a basement membrane, making it very easy for the bacteria to actually penetrate the vessel wall and enter the bone tissue. So when the bacteria actually get to the metaphyseal area, okay, they just penetrate the blood vessel, get into the bone tissue, okay, and start infecting you. All right. Then the fourth reason, I've already explained this, right? You guys already know what metaphysis is, okay? The fourth reason is what? There's high concentration of osteoclasts, okay? So metaphysis has a high concentration of osteoclasts, which are cells that are responsible for what? Bone resorption, okay? And this process can create what? Small defects in the bone tissue, providing an entry point for the bacteria. In an exam situation, you could just grab like 3, 4, 5 of these reasons and you're good to go. All right, but it's nice to actually always grab everything. Okay, then the proximity, its proximity toward growth plate, that means it is closer to the growth plate. We say that the metaphysis is adjacent to the growth plate where the bone is rapidly growing and remodeling. Okay, so this area is a soft area and is more susceptible to infection due to increased cellular activity at this region. The poor immune surveillance. The metaphysis has a relatively poor immune surveillance compared to other areas of the bone, and if you have a poor immune at that part, you are more vulnerable to infections, right? Then hematogenous spread. Metaphysis is a common site for hematogenous spread of infection where the bacteria enter the bone through the bloodstream. Okay, so this is just like trying to, as a student, you break down all your points to the minimal level. So this is still related to what? Blood supply. Okay, has a high blood supply. So if bacterial infection gets into the blood, it goes there more. Okay, so that's it about what? Anatomical basis for why metaphysis is the common site for osteomyelitis in children.